This is our genetic test design for Alzheimer's disease. Alzheimer's is a common brain disease that impacts memory, thinking, and behavior. The APOE gene is a gene closely related to the development of the disease. The APOE gene's function is to transport fats into the bloodstream from one tissue or cell type to another, and is essential in helping to maintain a healthy metabolism of cholesterol and triglycerides. There are multiple variations of this gene, including APOE2, APOE3, and APOE4. People with the APOE4 variation have an increased risk of developing Alzheimer's by about 4.1%. To add, environmental factors such as exposure to toxic chemicals and head trauma can increase one's chances of developing the disease, but a person's risk of developing Alzheimer's has to do largely with genetic factors. 23andMe tests for 75 dominantly inherited mutations that are known to be associated with Alzheimer's disease. They predominantly test for GAB2, which is heavily associated with the APOE gene. GAB2 is a key member of the GAB family of proteins and is involved in amplification of signal transduction that is evoked by a variety of extracellular stimuli. These include growth factors, cytokines, and antigen receptors. If GAB2 is detected in neurons, it has been found that GAB2 modifies risk in APOE4 carriers. In SNP RS2373115, the risk allele is G. If you have one of these alleles, your risk goes up by 4.1%.
The SNP chip test that we created will consist of 100 genetic variations. Out of the 3 genes associated with developing Alzheimer's, a person with the APOE4 gene is most likely to get the disease. When the letter C is in both genes RS429358 and RS7412, the risk of developing Alzheimer's is the highest. When the letter T is in both genes, the risk is the lowest. There are 2 proteins that are affected by the genetic variation of APOE4. One is the amyloid protein and the other is the tau protein. The amyloid protein found in the brain and spinal cord is affected when abnormal levels of the protein bond together to form plaques within the neutrons. The tau protein is affected when the protein detaches from microtubules and attaches to more of itself, causing it to get tangled up inside the neutrons. The amyloid protein is found in many organs and tissues, but mainly found in the brain and spinal cord, and the tau protein is found in the brain. It does make sense that the genetic variations does have an impact on developing Alzheimer's because the gene variation is mutated, which can increase the risk.
Using our test can help you discover if you are at risk for Alzheimer's. Although you may have the genes to develop Alzheimer's, this does not mean you will get it. Our test will test for the R72373115 SNP and the GAB2 protein located on chromosome 11. The risk allele is G, which will give a 4.1% increase in possibly getting late onset Alzheimer's. We cannot test for all of the possible genetic outcomes. However, patients can test for their increased risk for developing late onset Alzheimer's. But the same patient can also go on to live a completely normal life. The opposite can be true as well. With someone testing for no increased risk, this person could go on to develop Alzheimer's later in life. If you are age 65, the risk of Alzheimer's is 2% annually, whether or not you have an increased risk due to family history. The number increases 30% annually if you have a family history of Alzheimer's. That'll push your number to 2.6%.
There are some ethical concerns relating to the creation of a genetic test for Alzheimer's. If a person that took our test were to test positive for one of the markers of Alzheimer's, they should still remember that the test only identifies that they are at risk, but they're not guaranteed to develop Alzheimer's during their life. However, some may still choose to prepare for the future regardless. These preparations can be financially draining for the families of the affected. These changes could also be emotionally draining, as the rest of the family is preparing for the tested individual to start suffering from the disease. Our company would not make the results of the test public So a person may choose to keep the results private if they wish, because those who are test positive for a genetic marker of Alzheimer's would be likely to be treated differently from others.